Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. Have you ever wondered what really happens in the operating room once you're under anesthesia? Today on Shadow Me Next, I'm thrilled to welcome Alyssa Ellis, a certified surgical technologist, certified surgical first assist, and the creator behind the rapidly growing platform Beyond Assisting. Alyssa has built a career rooted in skill, grit, and deep passion for education. And now she's using her voice, literally, to change the way we understand the OR. In this episode, you'll hear how a spontaneous decision to enroll in surgical tech school turned into a 16-year career across multiple hospitals and specialties. You'll hear what it's like to be the extra pair of hands in the room when the pressure's on, how Alyssa learned to navigate high-stakes surgeries with confidence, and why she believes that admitting what you don't know can be one of the most powerful tools in medicine. We also dive into the reality of working in a fast-paced OR, what collaboration really looks like between techs, surgeons, anesthesiologists, and nurses, and how Alyssa balances professional excellence with authenticity. She's building something big, an educational platform that's already helping students, surgical staff, and yes, even patients better understand the tools, techniques, and teamwork behind every procedure. So if you've ever asked, what does it take to become a surgical first assistant? How do you earn respect in the OR without a white coat? And can you really teach surgical efficiency with a sarcastic whisper? This is the episode for you. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Alyssa Ellis. Hey, Alyssa, thank you so much for joining us today on Shadow Me Next. I cannot wait to have this conversation with you and to learn so much about your roles and what you do and hear about how you are truly changing healthcare with your platform. People are going to love this. Get excited. Alyssa, thank you so much.
Of course. Thanks for having me.
Oh, so great. So, okay, before we get into anything, we're going to do things a little funky. Let's pause briefly, and I want to play a little clip of what you show on your social media.
This is bowel, still connected to everything else. So when we're doing an open case, although this does go for laparoscopic or robotic as well. So let's say we need to take out this blue part, okay? It will most likely be a GIA 75 that you would need first.
So Alyssa, tell me about this social media world that you have created, this incredible platform. People are loving this.
It's so funny. I actually only started this, I think the end of December, beginning of January. I just started it, which is insane. Wow. But I've always really loved training, coaching, teaching. I love it. I love seeing the progress. I really do want to help everybody and help them be better at their careers, be more successful. So I just start teaching some stuff and I tell one sarcastic story in a sarcastic whisper and it just sticks. I'm like, oh, great. I'm the sarcastic whisper girl now. That's literally how it happened. And then ever since then, I'm like, well, I know what's sticking. I knew that with this platform, I'm like, okay, I have to stay in my scrubs. I have to be teaching one thing, but I'm loving it. I've gotten so many great messages from people, surgeons telling me, hey, I never knew that. Thank you so much. I've heard it from med students coming in. Oh my gosh, now I know what to do when I go in. And so everyone's just learned so much. Surgical techs that now have decided to go back to school to get their certification so that they can go work. I gave them that little push, and like, that is enough for me. Just the fulfillment that I get from that is incredible. So
I think that's great. And what you said is such an important thing to remember in medicine and really in anything, but we should never assume that just because someone has a certain title that they know everything or that they know something. You mentioned surgeons. Obviously, surgeons know so much about so much, but there are things that are really niche to you, and to you and your roles in the OR. And it's cool. It's so cool that, just looking at your platform, you have people from all walks of life in the OR, but not just the OR, students and probably regular
I have
people.
regular people that just want to know how their surgery went when they were under. They're like, that is so incredible. Or people that just are interested by it. And I think it's so amazing, but I guess there's not really anything out there like this. And so I'm like, oh, this is very unique. I didn't realize how unique it was until I have 50,000 followers on Instagram. And I'm like, oh my gosh, how did I get here? I don't know how I got here.
We're going to jump into the quality questions segment a little bit early in this episode. Quality questions is an opportunity for you as a pre-health student to become exposed to a number of interview questions that you may or may not have to answer when interviewing for your own pre-health position at some point. Alyssa's whole journey is a perfect quality question, really. And that question would be, are you showing up in a way that makes healthcare better, not just for your patients, but for your coworkers, your students, and the next person walking into that room? Consider this. And while you're on your job, make sure that you can answer yes and then give tangible examples. It's incredible. It's such a fun platform. I have found myself just sitting there listening to your wonderful sarcastic whisper voice. It is fantastic, but just really absorbing the information that you're teaching, which is so cool. So Alyssa, let's go back. Tell us a little bit about what your titles are. What do you do? What does it mean? How did that get you into the OR in the first place?
Okay, so it's a funny story. I actually was not interested. I hated watching all the ER shows. Seeing the blood and guts grossed me out. So to my friends, I think I went when I was 19, 20 years old, I went to school. They're like, hey, my mom's a surgical tech. We should go to school. Okay. So that was it. Like I was working at Kitty Candid's and where else? Payless Shoe Source at the time. And I'm like, okay, I had a kid already. And so I was just trying to make ends meet. I wasn't really thinking about what I was going to do next. And I just kind of went with them. 2 weeks into the program, they both quit.
Are you serious?
Thanks my friends that got me into going quit. So I'm like, okay, well, I'm not someone that starts something and doesn't finish it. So I'm like, I'm paying for this already. I'm not going to pay money unless I'm getting that to the very end and I get a job out of this. So I ended up going through getting my certification as a surgical tech this was in Utah, and now I'm in Vegas, but I ended up getting hired on at the facility that I did my clinical rotation at right after. Worked there for a couple of years and then moved to Vegas, and I've been here for, my son's 13, so about 13 and a half years I've been in Vegas. And 3 years ago, I got my first assist. First assists weren't really a thing, I feel like, as much in Utah. So I didn't see it as much until I got here. But even here, I worked at a level 1 trauma center, and it was a training facility. And so you have medical students, residents. You don't necessarily need first assists and PAs there. You rarely see them. You just have residents and medical students. And so I ended up going to another hospital, and that's when I interviewed for the position to go to school and get it paid for to get my first assist. And that was just the next step in my process. And that was just where I could go next, really. So I ended up going. It's about a year program. And then I have my CSFA, Certified Surgical First Assist. So I'm a CST, Certified Surgical Tech / CSFA.
Incredible. Incredible. And I'm so glad you brought up how at a teaching hospital, you have med students and you have residents and you have PAs and you have other, we call them APPs, advanced practice providers, who are kind of, you're sharing that role, right? I mean, we're all learning. You're the professional at what we're learning how to do. But there is this interesting hierarchy in medicine, and sometimes the hierarchy, comes first. And that can be challenging. So I'm glad that you were able to kind of find your footing and find that role. Tell me a little bit about CST school. So could you come just right out of high school, or did you have to go get
right out of high school?
Out of high school.
So
cool.
I mean, granted, this was 16 years ago. So I've been doing this a long time. I've been doing it since I was 20. So I am 24 now, but I've been doing this for 16 years. I don't know how that works.
Good math. That's correct.
I know, it's crazy. But it was probably it was like 15 to 18 months of school back then. I think it's more now. I think you have to get your associate's degree now, whereas back then you did not. Okay. And so I busted through my clinicals. It was like 540 hours that I needed. I went every weekend because I ended up getting laid off at Kitty Candid's. They closed down. And it was like on a Thursday, the next Monday was when my clinicals started. So I was like, I have to get this done and I have to get a job. I need to start working. And so I think I got it done in like 2.5 months or something. I mean, I was there every day, late hours, just so I could get all my cases done, all my hours logged, and then finished on a Thursday. I got all my resumes together and I was ready to start in Salt Lake and go south. And I was just going to show up at every hospital, go to the HR department. And I was going to say, I want a job. How do I do this? Who do I talk to? And I pull up to a hospital in Salt Lake. I can't remember which one. Right when I park, I get a phone call from where I did my clinicals at Utah Valley Regional Medical Center in Provo, Utah. They call me. They're like, hey, so can you start on Monday? I'm like, what? So they hired me right away. I started the next Monday. It was incredible. I didn't have to go through all that work. It was such a blessing. So
that's awesome. So okay, you mentioned hospital. Obviously, there's ORs in most hospitals, trauma 1 facilities, things like that. Where can you work? I mean, what does it look like? What are the locations?
Right now I work for a hospital, and so I can work for any of their sister facilities, and they have outpatient centers. I can go and float over there, but I do work full time for one facility at a hospital right now. And I was at a different, in a different system before this at the hospital I was at. And at that one, I couldn't float between facilities, but I've been to almost every hospital in Vegas. Like I worked at Sienna St. Rose, which is on the other side of town from where I'm at. And I think I was per diem there while I worked full time at the trauma center. Wow. So I've been everywhere. It's really a small community too. Everybody knows everybody. So anytime an applicant comes in, I'm like, hold on, what's their name? Okay, I don't know them, but I'll figure it out. I know who to ask. So you got to make sure that you keep your relationships very professional and you leave on a very professional basis and make sure that you could go back to the same place that you left.
No, that's a good point.
We talk. Everyone talks.
No, it's a very good point. And it's not just, it's not just how good are you at your job. It's are you a good team player? Obviously, we're going to talk about this, and this is going to be huge in your role. You know, are you a respectful person?
It doesn't matter where you're at and what field you're in, what industry you're in. You're going to have the people that are more difficult to deal with, and you're going to have people who are more easygoing. And so it's really just how you adapt to that and how you figure out how to be around people and communicate with them effectively and really grow up a little bit. Honestly, I can be a little blunt sometimes, but really, I mean, it gets to a point where, and the OR is not somewhere that things are held back. So if you don't know what you're doing, do not come in and pretend like you know what you're doing, because that's harm to the patient. But it's okay. Right. It is 100% okay for you to say, I have never done this. If I've never seen something, to this day, I still see new things that I've never seen before. And I will ask questions. I think I just got told a term the other day we're doing a cranie or something. And I can't remember the term, but I remember I'm like, I've never heard that before. What does that mean? Where is it from? And he told me, I'm like, I didn't know that. Like, I didn't know that this term could be used for that and this. Two different like types of procedures, but that term I thought was only used for this one can also be used for this. And so I'm learning something new every single day. And it's okay for you to speak up and say that you don't know something. I have never gotten in trouble or yelled at for asking a question. You just have to be smart about when you're asking it. You have to read the room. Is it tense? Is it high stress? Do they like talking? Are they focused? Like, you have to be paying attention to so many more things than just the instrument that they're asking for next.
No, that's a really good tip. Actually, read the room. We could do a whole masterclass on that, and everybody's questions are valid, but there are invalid moments to ask them. You have to wait. You mentioned a cranie, Alyssa. I'm just like shaking in my seat. So excited to talk to you about all the procedures that you do as a first assist right now. And as a CST, okay, let's talk about it. So day in your life, you walk into the hospital. What are you wearing? Are you wearing a suit? Are you wearing scrubs? Like, start from the beginning and walk us through the whole day.
I usually wear like just jeans and a bit baggy t-shirt or something, because I'm about to change into the OR scrubs, because you can't wear your regular scrubs into the OR. They have to be the hospital provided scrubs that are there, that are washed by the specific detergent that they use so that they're clean to their standard or whatever. So you go in with your regular clothes and then change into my scrubs, grab my scrub cap, and then we go have morning report, and I see where I'm at and I go to my room. I'll go in any room. I'm really put anywhere at this facility. I've never done hearts. So hearts is something that I have never done. I think I've seen one in my entire career. It's just not something that I've done. The facility I'm at now does not do them. And so I'm never going to be in one where I'm at. But I was interested at one point, but to be honest, I've been doing this a long time. I am not about to take heart call. I have lots of kids at home, so I'm not trying to be gone more than I already am.
No, that's so true. So when on any given day, are you assigned to a certain service, like, GI or GYN, or could it really be anything?
Really could be anywhere, at least for me personally. And so maybe not necessarily for everybody, but for me personally, I get put into any room, but there are my specific days. There's a surgeon that goes there once a month, and I am always in his room. There's, every Monday, I'm always in the same room, and some Thursdays, just depending. So it just, when certain surgeons are there, I'm usually in there with them. And they're used to that routine. They're used to me. They're comfortable with me. And so that's what they want. But if those surgeons are not there, then I'm anywhere. So, and then when those cases are done, I work 312. So when those cases are done, right now we're short staffed. So when those cases are done, I'm going into another room or relieving somebody to go home or whatever. So.
Wow. Gosh, this is actually a really great segue to talking about collaboration and the vast number of different healthcare workers that you work with. And some of these people are obviously clinical, and I'm sure some of them are administrative, a bunch of different roles. Tell me about that.
So you have your director and manager usually aren't coming into the OR. You have a charge nurse that runs the front desk, and they're typically the ones, and it'll be different throughout the week. There'll be a different charge nurse for Monday and Tuesday, and then a different one Wednesday, and then Thursday, Friday, or whatever. And they work 12s, at least where I'm at now and where I was at before. That's how it was. And then they make the assignments for the next day. They usually know who can do what, who is usually where, but also I mean, they just have to shift things around if people call off, and they deal with all of that. Booking cases same day, they deal with that, telling the surgeons what time it's going to be at, whatever add-ons, and then they place them in the rooms wherever the staff is going to be able to accommodate because of when the staff gets off of work also. And then I have an anesthesiologist is always in the room. So you have to have four people in the room to do a surgery. You have to have an anesthesiologist, you have to have a surgeon, you have to have an RN circulator, and you have to have a surgical tech. That's what you absolutely have to have in the room. Anyone else is considered extra. A PA coming in, even me as a first assist, I'm extra in the room. I am not necessarily, I don't need to be in the room. So I'm not a necessity. That's the word I'm trying to. I don't have to be in there, but there are cases that it would be nearly impossible to do without an extra set of hands. We could do it, but it'd be really hard. And I've done it, but it's really hard when it's just me and the surgeon, which is funny because I'm so used to doing so many things by myself and not having, when I was a tech at least, I didn't have an assist. I didn't even have another surgeon. I was doing badge hiss and I'm holding a retractor and loading my needles and passing them. It's me and the surgeon. There's nobody else. So when I see I don't know, it's just different. It's just different now. And it's nice because we can all focus on our roles. So it definitely is better, I think, for the patient because my back's hurting from doing that years ago. Instead of just being able to focus on one thing or the other, I was doing everything, but it did help me with my critical thinking and being able to understand the procedure as a whole instead of just being at the back table. And I don't say that in a negative way at all. I just know that as a tech, you are more in charge of the back table, which means that's where your sterile instrumentation is. You set up for the case that you're about to do, whether you're doing ortho, GYN, urology, you're doing, what are some other cases? ENT, plastics, whatever. There are so many different specialties that you could be going into. You're doing a robot, you're doing a big exploratory laparotomy for a bowel resection, you're doing whatever. So that surgical tech will go in there and set up that case. And so have all the instrumentation and disposable supplies ready for that procedure to start, count with your nurse, and you have lap sponges and you have to count instruments on some cases if you're getting into the belly. So there's a lot that goes into it. And as a first assist, I go in there, I'll help open, and if I need to drape the robot while my tech is setting up, then I'll scrub in, I'll drape the robot, whatever they need, so that we can try to move along and be as efficient as possible. So that's kind of the gist of it thrown into it.
It's amazing. It's amazing. I love hearing about the different roles because obviously, like you mentioned, everybody has a different role. Like as a PA in surgery, I would also first assist, and I'm not about to pop behind the curtain with the anesthesiologist or the CRNA and say, hey, let's talk about the respiratory settings on this patient. No, but at the same time, I might say, hey, can we tilt the patient back? Can we put the patient a little bit more T-work? And the anesthesiologist or CRNA might say, no, I can't, they can't breathe like that if I put them upside down too far, so everybody has their own roles and you're in constant communication. And it's not like you mentioned earlier about being blunt in the OR. There's no other way to communicate because everything said has to really be said for a purpose.
You just have to understand that it's not personal.
No,
I can't remember a time that I thought that a surgeon was saying something to me to throw a dig at me. I've never been kicked out of a room. I've built really good relationships up until this point, and I continue to do that because that's how I was raised. I was raised with really good work ethic. And so thankfully, my dad showed me that. And so I don't know. I just don't see any other way. You guys are operating. You're in charge of this patient. Ultimately, when this patient leaves the OR, they're no longer my patient. But they're still yours. So these are stressful cases. Some of them, these OB-GYN cases that they're going in and taking tumors out of these patients and then have to tell the family that they have metastatic cancer
Yeah.
Something that's taking over their body. So if they're yelling during that case and frustrated because they're not getting things fast enough or whatever, I don't take it personally.
That's great.
That's
such a good example.
You have to think more outside of yourself. You really do have to, in healthcare, I feel like in general, you should have some sort of selflessness and understand that it is not about you. It is about the patients and helping them in whatever way that we can. And that's something I feel like has kind of been lost a little bit, at least personally in my experience and where I've been and what I've seen throughout the years. I feel like it's just not the same. I'm not saying it's bad, but it's just not the same. And I think that you just need like a spark a little bit. Some people just need a little bit of a spark. So I'm trying to do that for who I can. So they'll maybe be a little more passionate about their jobs.
Yep.
You have the grumpy Gusses at work that you go, and I mean, I've had them. Some of them are just tired and exhausted and overworked, and I understand that. And they're tired of training. They don't want to train. I think that is unfortunate because I've never felt that. And usually my response is just, how did you learn? Like, this is how you learn.
Right.
So they have to learn somehow. You can't get upset at that. They're going to school. Then don't have them in your room if you're not going to teach them. That's how I feel. Because if you're not going to show them how to be a tech or an FA or whatever, then don't precept. Don't help them. But I can understand how that could be very discouraging for surgical techs, first assist, RN circulators coming in and getting all the negative from it and not getting good preceptors. I can totally understand that.
No,
and I try as hard as I can to like jump in and help whoever I can.
Which I'm so excited. We're going to talk about your new endeavor coming up here pretty soon, because it's what the world needs. It really is. But you mentioned two things that I want to just comment on because I think they are so important. Number one, you mentioned how, if you have a surgeon who you're working with and they're being emotional in ways that, you're thinking there's a lot going on with this, right? It is such a great example when I am speaking to like my student shadows that are in here and they're talking about, Ashley, do I want to go to med school? Do I want to go to PA school? Where do I want to end up in healthcare? Put yourself in those positions, right? So like trauma surgery. I was talking to a trauma surgery PA a while back and she said, Ash, I realized that I am willing to be there and do everything I can to try to save that patient's life, but I don't want to be the one that calls it.
Yeah, that has to be so hard. I can't imagine. But that's the way that some people think, but not everybody. But if that's never like told to you, then how will you know to think that way?
Perfect. And so I'm so glad you brought that up because you're absolutely right. In the OR, you get to assist and you get to be involved and you get to make some of these awesome clinical decisions. But at the end of the day, it is up to that surgeon to go and tell that patient about their limited time left on earth, most likely, and that it's just hard. So I'm so glad you brought that up. Thank you so much. And then number two, you mentioned just losing that spark in medicine. And that is exactly, we are trying to get back into the heart of healthcare, right? The heart of healthcare is just inspiring people to want to help others medically and change their lives outside of our hospital, outside of our OR, outside of my clinic, just enjoy themselves because they are healthy and they understand things. So I'm so happy to be able to do that here on Shadow Me Next. And I'm also so excited for your platform because you are inspiring the next generation of healthcare workers, of CSTs, of first assist. Tell us about what you got on your plate. Tell us about what you got coming up.
I am so excited. I've been thinking about it the past probably month since everything has been growing. I'm like, how can I make this into something that I can spend more time on first? Because I do work full time and I can spend more time on and help people and be able to genuinely like make a change in healthcare, where people are passionate about their jobs and passionate about helping. And if you know about the job, maybe it's something you don't want to do. Now that you know more about it and you're hearing how it can be, the stressful environment, how tense it is, maybe I'm not for that. I don't think my personality can handle that. Then you're not going into it first, whereas I'm sure so many have. And then they realize how difficult it is, and their personalities just don't match with it. And that's okay. There's nothing wrong with that. But you don't know what you don't know. So if you have no idea what this job entails, then you don't know what you're getting yourself into. And I understand that. And then that's when we start losing the passion, and there's just an extreme lack in healthcare and people that are passionate about what they're doing and helping people. So I just think so I am so excited to launch this platform. I've already started creating a website and app where we're going to teach them all the different instrumentation, why they're used, when they're used. And not only that, the sutures, so that they understand the size of the sutures and what order it goes in. So many of these things were never explained to me either. But, and it's okay, because again, if your preceptor doesn't know, they can't teach you that. But I know this stuff, and I am so willing to share everything that I know. Anytime anybody goes into a room with, like, my surgeons I always work with, if I'm off that day, I am the first one to say, who's in my room? Who is it? Okay. Hey, you want me to send you my notes? I have my notes in my phone. I already fixed the preference cards. That's another thing I do at work that I took on, which preference cards are basically just that, surgeons' preferences on a card that have all of the disposables and the reusable instrumentation on there. And then there's some notes in there just of specific things. So I've been kind of revamping how the preference cards were at the place that I'm at now. So I fixed that, but here's all of my notes. Here's all of my information. And anybody knows, they can call me on the weekend. They can shoot me a text. I'm going to help you. You're still my colleague. You're still my coworker. Well, I can't text you back. I'm always on my phone. We're all always on our phones. Come on, let's be real, guys. So if my colleague, my coworker is asking me a genuine question that's going to help them maybe not look as stupid, so they don't feel like they don't know anything, I'm there. I got you. And they know that. And they're comfortable with reaching out to me. And I'm happy that they are. And I hope they continue to do that. But I just want to share my knowledge so that everyone else can have that peace of mind, because you don't always have the best preceptor, and your preceptor may not understand to this extreme, but I do. I'm excited to create kind of a platform that's easy for you to go to through an app. And I'm going to call it same thing. It's going to be Beyond Assisting, and just helping healthcare really get better and be able to really drive that passion again, and just helping anybody going into the field. Because it sounds like so many like ER doctors are messaging me, everyone in healthcare. It really relates to anybody. And if you want to know about your procedure and you're not even working in the OR, then we'll go into depth, and I'll describe what a surgery is, all the things that we use in that surgery, how we position your arm, what equipment we put your arm in for a total shoulder. But it depends on the surgeon. Some surgeons use a Mayo stand. Another one uses a Tremano. One uses a spider. There's so many different positioning devices out there that we use. And it's different for each surgeon, even though it's the same case. There's just so much that goes into it, and so much that you need to know and try to understand. And I have so many ways to help the OR be more efficient. This will help turnover times. It'll help your efficiency. It makes everyone happier. The surgeons are happier, which makes the staff happier. I've worked so many different places that you really start to learn what works and what doesn't. But my way doesn't have to be the perfect way. I love hearing from other people's comments, how they do things. I'm like, oh yes, that is I'm going to try that next time. But you have to have that open mind also. I feel like going into anything, but you have to, especially coming into this career, and if you're thinking about it, you have to remember that things are constantly evolving and changing. Everyone does things differently. Just because one surgeon does it this way doesn't mean the next one has to do it that way. They can do it however they learned, however they want. So me assisting, I'm not going in there telling one surgeon like, oh, you need to be doing it this surgeon's way. That's the last thing you should say, by the way. But has there been a situation where my knowledge has helped? Absolutely. Because a newer surgeon comes in and maybe is just like, have you ever seen this or that, or what do you think? Then I can say, yeah, I've seen this. This has seemed to work for this person, and then this person does this. I've had them ask me, does Dr. So-and-so do this? Because they just want to know. They're not in there with each other. That's not usually what happens. So that's something that we see. I feel like it's very unique knowledge that I have because I am not just in one specialty, and a lot of us aren't. I've been in every case under the sun except for hearts, but I do vascular still. I've done an aorto-bifem case. I've done a femoral to femoral bypass. I've done fempops. So I still do vascular. I just have never done open hearts. I've done procurements. We've procured the heart. I just have never done open heart surgery. I've never cannulated. I've never done any of that. But I've seen so many things. Working at a level 1 trauma center, you see so many things. Some things you wish you never would have seen, but you still see it.
I'm so sure. I am so excited about your platform and about what you have really curated. I was going to say created, but it's just like you've been saying, it's after decades of experience and knowledge and being open to discussion with other people. You have curated all of this, and it's information. Obviously, that's great for people in the OR, but also for students, for pre-health students to get to see what they want to do. You mentioned just for patients or just the average Joe who's interested in this sort of thing. You get to explain things without the gore. Alyssa, thank you so much for doing this. Alyssa Ellis, Beyond Assisting on Instagram, TikTok, Facebook, soon to be her website, which I cannot wait to share along with you. Alyssa, it's been a joy. It's been a pleasure. And I am so grateful for what you're doing in and for medicine. So thank you.
Thank you for having me. Thanks so much.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.